Have you ever had your vision blocked? Your plans canceled? Have you ever been blindsided? Have you ever had the wind kicked out of you? My fellow leaders, storms will come. There are opposing energies we've yet to meet. They are ever ready, powerful, relentless. To borrow from Newton, each of our actions should anticipate equal and opposite reaction. It's a law of nature. Storms will come. Even when you're focused on your vision, especially when you're focused. The storms may feel unpredictable. It may seem that the more you advance, the more frequent, the more intense, the more targeted the storms seek to destroy. It may seem that the closer you get to your goal, the more erratic the opposing forces become. But there's a secret that every physical therapist knows. We were built for this. We were designed for uncertain times.
And it was hard. But I had a cheerleading squad around me through emails, text messages, phone calls from each of you, supporting me and helping me believe in myself and to see the change as an opportunity. So I embraced it. And here I am 5 months later, practicing as a PA for Tarrant County Public Health. And I am a change machine. Taking in pennies, spitting out dollars. But for real, I love change. It's still hard, but I'm hunting for it around every corner. How can we change a culture? How can we improve access to care? How can we change systems to make bring more equity to our care?
As I've said before, I work on pipeline program development because I know they work. I do this because I want to make sure that Todd, a young Black man raised in Richmond, who attends Berkeley City College and works 2 jobs at Home Depot and in our clinic as an advocate, learns about different careers and sees a possible future as a provider. After shadowing one of our family medicine residents, he was excited to share. I shadowed a family doctor today. It opened my eyes to a whole new set of the medical field. I learned a lot. I work with our community partners, Public Health Solutions and RISE, to provide clinical shadowing opportunities for Deja, a Richmond native and young woman of color who attends De Anza High, so that she learns about behavioral health as a possible future career and the dire need to have young women of color provide trauma-informed care to our communities. She stated, "I was able to shadow a psychologist, and she told me that the field wants to see young women, and particularly a young woman of color, and she reassured me that there are opportunities for me." I work in collaboration with Jen Shrestha, Angela Rogers, Jen Estrada Melgar, and a group of residents of color who recently formed our residency program's first ever Resident Diversity Council. And I help to cultivate their leadership skills and anchor their commitment to young people across Contra Costa County. Because truth be told, I want the young folks who live in Richmond and have shadowed in our clinics, like Todd, Deja, JJ, and Consuelo, I want them to find their calling, their possible future, and to imagine themselves as health professionals occupying seats in this room to become the next visionaries and bold leaders of a future generation.
No action for improving health equity is small. We all have the potential to contribute in some ways. I call upon public health professionals to introspect themselves and assess how best can they contribute in bringing about health equity, in prevention of disease among most vulnerable populations, in saving a mother from dying during pregnancy or during childbirth, and how best can they save every newborn. As Mahatma Gandhi said, "You must be the change you wish to see in the world." I ask, will you be the change you wish to see in the world? For you and I can make a difference.
There is the fear of being underestimated because of my Southern accent. And y'all, yes, I said y'all, there are insecurities I have as a mother in trying to achieve my goals and yet be there for my sons to nurture and prepare them for theirs. There is insecurity in knowing that I am the mother of 3 Black boys in America who could be targeted by police any day without consequence. To battle my insecurities, I have always found freedom and sought solace in educational opportunities, because one thing was for sure: you could say many things about me, but unintelligent would never be one of them. My thoughts were education would be my ticket to security and provide me with opportunities that I never knew existed. And my education has delivered on that promise. My life has been forever changed.
So where are we supposed to be? It may not even be a physical or geographic place. They say that the best place is where it is most uncomfortable, because because this is where the magic happens. Maybe all we need to do is step out of our comfort zones and discover the great things that can happen. All throughout our fellowship, I've met great people who are so passionate with what they're doing. All of you in this room, my dear fellows and mentors, reaffirm the 3 life lessons I've learned: purpose, people, and place. We have so many choices in life, but my ask is that you consider choosing to live a life of significance. That is to live with a purpose, to live with passion, to live with wisdom, and to live by faith. There is a whole wide world out there, a world that we won't like that much or not at all, but the opportunity to make the change is in our hands. We have been tapped to pay it forward.
Combating health inequity is not something that economists, lawyers, dentists, physical therapists, physician assistants, public health researchers, physicians, program and department directors, or academics in our silos will fix. We must first identify where the issues of health equity are at play in our unique interactions with individuals, communities, and systems. And then we need to share our particular experience and expertise with each other when banding together with colleagues from other perspectives. Like my front desk staff and my nurses, we have to talk to each other and stop talking about each other.
I want to highlight something that I spoke about earlier from our trip to Rwanda, a country that has suffered, but from that suffering has learned and created a society focused on equity, valuing all people regardless of differences. At the Kigali Genocide Museum, there were these huge banners with a drawing of a flame and with the word Kwibuka, which means to remember. Kwibuka calls on the world to stand against genocide in 3 key ways: to remember, honoring the memory of those who died, offering support to those who survived, to unite. Rwanda shows that reconciliation through shared human values is possible. They ask the world to do the same. To renew, as they build Rwanda anew, they are humbled to share their experiences and learn from others. Let's create a better world together.
But I think it's important always to imagine for at least 1 minute what may feel somebody that goes to seek healthcare to a hospital with difficulties in their communications. I think we need to be able every time to feel in ourselves the injustice that many times occurs in ourselves. And in some ways is to be able to put ourselves in the shoes of the others. And this empathy. And I think it's something that has to be in the front of our minds when we are trying to work in health equity.
He looks like he has surrendered, and the day is only just beginning. Why is this man spending the last years of his life on the street, surrounded by traffic, while my grandmother is aging in her home? For generations, we have told ourselves that it is because of the choices they have made throughout their lifetimes. We've reassured ourselves that we can ignore the sick and the poor among us because they have simply failed to make the right choices. But what we as students of health equity, as leaders, know is that these disparities exist because of the choices we all have made. Especially in the richest country in the world, we have health disparities because we choose them.
One night, one of my South African friends and I were having dinner, and his phone was buzzing constantly. I told him to answer it, and when he did, within minutes, his face was frozen. His ex-girlfriend was calling him to tell him that she'd been diagnosed with HIV, and she was so scared to tell anyone about it, she thought her life was over, and that night she had planned to commit suicide. Fortunately, my friend talked her out of it, and I'll tell you she's living a healthy life today. But when I came away from that experience, I wondered, how was HIV so prevalent despite being preventable? And even worse, why were people considering suicide when, at least in theory, treatment was available for free? That experience lit a fire in me.
I ask that you add voice. Add voice on behalf of those that don't have voice. When we sit at tables that we often have privilege of sitting at, make sure to consistently think about who's not in the room and how can you best bring their voice to the table. Consider those who may never know the actions that you're taking, but that will reap the benefits of the small or the large decisions that we make on a day-to-day basis. And then lastly, I say, act courageously. And in acting courageously, you act with consistency. You act with integrity. You make sure to align all of your actions in such a way that it pushes the needle in the areas that we're working within.
Wholesome fellows, tell them that you love them. Tell them you love them for who they are. Wholesome fellows, tell them that you love them. Tell them you love them as true citizens. Wholesome fellows, tell them that you love them. Tell them you love them to stand for justice. There is a language the fellows speaks. There is a chorus the fellows sings. I am privileged to join them sing that we stand for equity, that we stand for justice. Thank you very much.